Here. Okay. Yay, our speaker is here. After a long voyage across the city of Los Angeles and navigating the traffic problems that she's going to solve, we have Seleta Reynolds here today with Matt Gale from her office, LA City Department of Transportation, where Ms. Reynolds is general manager. She's led a number of really innovative programs and initiatives in the city around transportation, really thinking about 21st century solutions to our transportation problems in our metropolis here. And one of these initiatives that she's going to be talking about today is Vision Zero. And maybe talk about a little bit of the controversies around that program. Ms. Reynolds is also president of the National Association of City Transportation Officials. Let's welcome Seleta Reynolds.
Thanks, Dr. Cole, and y'all can all hear me? We're good? So I'm going to kick us off, and then Matt Gale, who leads Vision Zero for LADOT, is going to give you some of the basics, and then we're going to talk a little bit about some of the specific projects that we've been working on. So just to start, though, I think it's important to have this framing. So people ask me, what are you doing at the Department of Transportation? What are your goals for the city of Los Angeles? Because it's a big job. It's a big department. 2,000 employees. We oversee 7,500 miles of streets, 4,500 signalized intersections, 37,000 parking meters, millions of parking tickets every year, as well as crossing guards, LADOT Transit, which moves 22 million people every year. This is a big place, a big city, a big job, but it's also a job where the workforce has diminished by about 30% over the past several years during the economic downturn, and the folks who are left of the workforce that remains, 50% of them will be eligible to retire by the middle of next year. So we have big challenges, and it's important for us to be really ruthlessly shrewd about how we spend our time. So it really falls into these three buckets. The first is to build safe, beautiful streets. Sort of the centerpiece of this is Vision Zero. It's very much a public health initiative, and it is about getting to zero traffic deaths by the year 2025. There are lots of other things in this bucket. Most of them involve treating streets as public spaces, looking for opportunities to leverage the streets to provide opportunities for physical activity and community building and neighborhood building in streets. The second is, how do we manage people's mobility? So we cannot just be in the infrastructure delivery business in departments of transportation around the United States, given the explosion of private mobility providers. Uber and Lyft, sort of tip of the iceberg. There are dozens of others. But also what's coming next, the arrival of connected and driverless vehicles, and whether or not that will be a help or a harm to cities is really important for city transportation officials to be thinking about. And then the last is just making LADOT a really great place to work. This is the hardest part of my job. It's what I spend most of my days doing. I am the 8th general manager in the last 14 years, and I've been here 3 years. So, imagine what that does to morale and employee engagement when there's a constant turnover at the top of the organization. So really, I'm not going to be successful in either of these first two buckets if I don't nail that third bucket. Across all of these, I would say our main goal is equity. It's not something that sits on top of another agenda. Equity is our agenda. And when I say equity, I do not mean geographic equity. I very intentionally mean racial equity and socioeconomic equity. Transportation has the power to be a connective tissue that brings people to opportunities, that makes communities better. But because of a long history of redlining and racism systemic in this country, transportation has ended up doing just the opposite. You can get to about 12 times as many jobs in an hour by car that you can in an hour by public transit. So if you can't afford a vehicle in the city of Los Angeles, there is a ceiling on your opportunity. So these are the things that we're really focused on, and as you'll hear, Vision Zero and traffic violence in general is something that disproportionately impacts low-income communities and communities of color. So Vision Zero is very much a way to drive our investments to communities around the city that have have suffered from decades of disinvestment and really disenfranchisement. So with that, I will turn it over to Nat.
All right, thank you very much. Can everybody hear me? So I'm Nat Gale. I lead Vision Zero for the Department of Transportation, and I'd like to start just by talking a little bit about some key stats and really, what Vision Zero is all about. So you heard Seleta talk about it's zero what? Traffic deaths. Zero traffic deaths in Los Angeles by the year 2025. It's not unique to Los Angeles. It's a global, multinational traffic safety initiative. It started in Sweden in 1997. And it's not a Department of Transportation-led initiative. It really is a public health issue. And it's because people are dying almost every day on our streets. So if I were to ask you, gang-related homicides or traffic deaths, which do you think is higher in the city of Los Angeles? Well, you know that because I'm about to give you the punchline. That's right. More traffic deaths in any given year than gang-related homicides, and almost exactly the same number of homicides in general. Roughly 300 homicides in the city of LA every year, 260 traffic deaths in the year 2016. Those are 260 families, communities, neighborhoods that are forever impacted and affected. And for the majority of the history of transportation and public health in the United States, that's just been the cost of doing business. It's an accident, it happens and then we move along. Whereas homicides, we've oriented almost half of our city budget towards stopping homicides and investing in public safety as a really critical item for cities to double and triple down on. And Vision Zero is about elevating traffic safety to that level as well, and recognizing that we can't do it alone. Transportation department can't do it alone, public health department can't do it alone, LAPD can't do it alone. We have to be working together. Transportation engineers have to think like public health advocates. Our advocates have to think like law enforcement. Law enforcement has to think like engineers. That's how you get to Vision Zero. And that's why when we launched it here in Los Angeles, this is a picture of Mayor Garcetti and advocates and public health experts and community leaders and public works leaders all coming together and saying this is our goal. Zero is the right goal. It's the only goal that we should expect. And we're going to get there by the year 2025. So the other thing that Vision Zero is, it's a data-driven initiative, right? It's about looking at lots of different data and figuring out how do we go about systematically attacking this issue and driving those numbers down. So what do? We took 5 years of collision data to understand a little bit about what was going on with traffic deaths in the city of Los Angeles. And the first thing that we realized is that makes sense. Roughly 86% of collisions on the left there are vehicle-to-vehicle collisions. With the sheer number of cars out on the streets, fender benders that are happening at any given time, 86% of collisions are vehicle-to-vehicle. Only 8% are involving people walking. But Vision Zero is not about zero traffic collisions. That's an easy mistake that we hear a lot. It's about traffic deaths. It's not collision reduction, it's injury reduction. So when we look at actually who's dying, almost half of the deaths involve people walking or biking. Another constant thing we hear is it's about getting to zero pedestrian deaths, but it's not about zero pedestrian deaths, it's about zero traffic deaths, but how we get there as quickly as possible is focusing on this overrepresentation, where we see people walking and people biking are overrepresented in the data for people who are actually dying. If we can improve those locations first, we're going to get to our goals a lot quicker. So this is our first step in looking at what does the data tell us. This is another way of slicing the data in terms of the last 13 years, where have the different modes fallen along number of traffic deaths. And you can see the light blue line, which is vehicle deaths, is pretty, it's going down over the course of the last 13 years. That's a testament to the vehicle industry. They've dedicated a lot of resources on passenger safety, seat belts, airbags, child seats. But that red line, the line of the pedestrian deaths, has been stubbornly constant. And then last year we had a huge spike, not just in Los Angeles, but all across the country. And so this is, again, identifying that we have a problem. If we keep doing traffic safety the way that we've always done it, we're going to continue to get the same outcomes that you see here. And so Vision Zero is a new way, a new frame of looking at this issue so that we can dramatically reduce those numbers. Some of the other data that we analyzed that we found is that 70% of the traffic deaths are caused by a male driver. And so we first called the DMV, said stop issuing driver's licenses to men. That didn't go over so well. So our next step was to actually map this data, right? Because it's one thing to look at the data in a vacuum, but when you map it, this begins to tell you, again, a little bit about how you can prioritize your work. And so we found first that only 6% of the city's streets account for 65% of the deaths and serious injuries for people walking and biking. We call that our high injury network. Those are the dark red lines on the map on the left. We additionally overlaid that with our plan for a healthy Los Angeles, which talks about negative health outcomes, childhood obesity, asthma rates, etc. And we found that 50% of that high injury network falls in communities with the most negative health outcomes, which speaks to what Seleta mentioned, that this is really a social equity issue. That concentration of traffic deaths are in communities that maybe traffic violence isn't an issue that has risen to the top because there are so many other issues, but that doesn't mean that we shouldn't be approaching that first. This is not about a squeaky wheel getting the grease when it comes to transportation. This is about knowing where our problems are and directing our resources there. And so that's a new approach for a transportation department, and it's a new partnership for us to make with public health, law enforcement, advocates, etc. How do we get there? What are the strategies? Again, this is really, really critical. There are these sort of traditional 4 E's, 5 E's, 6 E's of traffic safety, engineering, enforcement, education, evaluation, but they have to all work together, right? And one of the things that we actually talk about from a transportation and design perspective is that the most sustainable way to get to Vision Zero outcomes is by leading with design, because design is the most permanent, sustainable change that you can make. Enforcement, education are really critical parts of the toolbox. They have to go hand in hand with when we think about changes to a street. But if you really want to change behavior, calm speeds, the most surefire way to get there is by physically changing the design of the street. And then we need to measure what we're doing. Is it working? If not, how do we change it? How do we develop new strategies? Underpinning all of these is equity and engagement. Again, as Seleta mentioned, really critical to be thinking about how we reach our communities, knowing that the language and vocabulary of public health experts or transportation experts does not translate into the vocabulary of the average Angelino. And so if we're really invested in making changes that are welcomed by a community, we have to think about how we engage, how we're culturally sensitive. And so this leads directly into the different outcomes that we're looking for in our Vision Zero action plan. There are some copies up there for folks to take home with you. It's really critical that we didn't organize this around those E's, because that would just put us in our silos: engineering silo, enforcement silo, education silo. Instead, we want to create safe streets for all. We want to develop a culture of safety so that everybody involved, whether you're a LAPD officer, a traffic engineer, or an advocate, recognize your role in each one of these outcomes. Now we have to do it all together. So to take a little bit of a deeper dive into what this actually ends up looking like on the ground, I'll invite Seleta back up.
Great, thanks Nat. So, what do we do? So we'll start with sort of an education campaign that we've rolled out over the last, we started it in April, and it's been out on, we focused on 10 corridors. So we identified about 40 corridors throughout the city where, number one, we had the highest number of deaths, so we're the worst of the worst. Number two, we had a high representation of older adults and children. So traffic crashes are the number one cause of death for kids in LA County under the age of 14. That's not accidental deaths, that's deaths, full stop. So we looked at streets where kids in particular were getting injured and killed. And then we also wanted to give extra weight for those corridors that were in those communities of concern that we mapped out earlier, so that we could really start to dig into the intersectionality of all of these different issues. So we talked to a lot of focus groups, a lot of men in particular, to find out what would resonate with them. And what we heard is people want to think they're part of the solution. They don't want to be shamed, they don't want to feel guilty, and they were shocked to hear these stats and these pieces of information. So the driver, it's from the driver's perspective. The driver is a man, the focus is on kids, and the message is that at 40 miles an hour on Adams, so it's very specific to whatever corridor you're on, even a good driver's car is deadly, and then it gives you something specific to do. Check your speed to keep kids alive. So it's really about one specific behavior change that we think is one of the most meaningful. A crash happens when we make a mistake, right? When I'm distracted, when I've got my own 2 kids in the back seat getting into some sort of extended wrestling match, and I'm trying to think about what's for dinner, and I'm trying to make a left turn across Wilshire, then a crash might happen. But a death happens when I'm speeding, right? That is the difference. That is the biggest predictor of the severity of the outcome, is how fast the driver is going. But we knew that we wanted to go further than that. So we wanted to work with artists, we wanted to work with community-based organizations, we wanted to work with non-traditional partners, we wanted to use Vision Zero to invest in the community architecture and structure in these communities. So these are luchadores doing a sort of an event around Westlake. We also staged a telenovela around Westlake. We had an artist do all kinds of murals along in Filipino town. This is an installation that went in on Adams.
Yep.
I always get it wrong. Adams. This is the number of people who have been injured or killed at this location. And on the pavement below, it gives you some information. So Vision Zero at its heart is about storytelling and culture change. It's about startling you out of your everyday behavior and bringing attention to the things that might be invisible otherwise. And artists are much better at that than engineers and planners. And so we wanted to engage that community because we're the creative capital of the world. We also engaged students from the Mayor's Youth Council, and what we heard from them is that they wanted a digital tool to use to engage the adults who drive them around town, to help talk to them about the outcome of their behavior. So this is countywide. We worked with the coroner's office to get information about every fatality on the streets that we could. If we have the family's permission, we put up their name, we put up their age, we put up a story about their life, and we let people go up and leave digital memorials so that they can have a place where they can go and share stories and also share information with their communities. This is Los Angeles, so we made a movie. This is about a 3-minute clip that we made. You can look at it on YouTube. I'm not going to play it now. But the main spokesperson in this video is the chief trauma surgeon from Children's Hospital. So we know that people don't trust government. That's not a big secret. But we also know that they do trust experts, and in particular, experts from public health. And so we wanted to bring those voices into this conversation in order to help people really understand the human side of Vision Zero. So, moving into engineering a little bit, this is one of our first Vision Zero projects. This is Hollywood and Highland, two big-time streets that intersect at a place that is constantly full of people walking, biking, taking transit, very healthy, vibrant street. Somebody was getting injured or killed on foot in this intersection once a month. And that is because, this is our red carpet to the world. People land at LAX, they go to Harry Potter, they go to the Walk of Fame, they go to Disney, and they go home. Right? And so this is a place with a lot of people walking and a lot of conflicts. So we put this in. This is the biggest, we call this a scramble crosswalk. This is the largest one of its kind in the city. We have about 13 or 14. We're about to put 3 more of these in around Westlake. And the way this works is that drivers all have an all red, so they stop in all 4 directions. People walking can cross in whatever direction they choose, including diagonal. And then the reverse is true. So people walking wait on the corners. Drivers can make their turns, can get through this intersection. And since we put this in November of 2015, we have had 0 injury collisions at this location. There's literally 24 people walking around right now because of some paint and some signal timing. Vision Zero is about understanding with microscopic accuracy why crashes are happening and choosing interventions that really address those specific causes. So we also, in our sort of action plan, identified these 40 corridors where we wanted to go in and do education, enforcement, outreach, do all of these kinds of things. This is a map of where they are, and you can, if you're interested, look a little bit more closely in the material that Nat brought. This is what we've done so far. So over 400 crosswalk upgrades, 120 what we call intersection tightening. So turning vehicles are a really important cause of pedestrian injuries and fatalities. So right turns less so, but left turns about 3 to 1 outnumber right turns. And that's because, as you're trying to make a left turn, if you don't have that little green arrow, you've got a million things going on, you're distracted, and the A-frame of your vehicle literally obscures where a person walking would be standing in the crosswalk. So I actually just saw that Toyota pulled a patent for transparent A-frame. So again, it would be great to see some leadership from auto manufacturers. But in the meantime, we put in these bollards to slow turning drivers down and to bring their attention, to direct their attention to the crosswalk. And then about 109 of these speed feedback signs. So you've seen these, right? They say speed limit 25, your speed, 35, which is great, but as you probably have figured out, these don't actually issue speeding tickets, and nothing really happens if you are going 35 miles an hour and drive past one of these. So we worked on an innovation to this, and I'll just play the video so you can see how it works.
Okay, we'll get this on up to about 42.
So he's breaking the speed limit, don't do this at home. Passes the sign triggers that he's speeding.
There goes the yellow down there.
Downstream light turns red because he's speeding. Right? So there's a consequence, right? And it's not a point on your record, but there is a consequence. And we're testing out the technology now. You see there's one of our signal techs actually there in the field. And once we feel confident that it works, we expect to install it on probably, I don't know, what do you think, half or so of the speed feedback signs that we have, and probably eventually put up some changeable message signs that say, if you speed, the light will turn red. The president of my taxi commission, yeah, you have to make it real blunt because, people have a lot going on. The president of my taxi commission, in an exceptionally petty suggestion, suggested that we have a spotlight that we actually shine on the driver who forced the light to turn red, because peer-to-peer shaming is a really important part of behavior change, as I'm sure you know. So next up, we're putting in a lot of left turn arrows, which is good for drivers, right, because it eases your stress as you're trying to make it through a lot of Los Angeles's complicated intersections. We're putting in something called a leading pedestrian interval. It's also called a ped head start. So this is where, when you're waiting to cross the street, you get the little walking person before the drivers get the green light. So you're able to establish yourself in the crosswalk before the drivers are released on the green light. We've done it all throughout downtown. It's been very effective and incredibly popular. People really like it. So we'll be putting it out on all of our corridors as well. Some overhead beacons and upgraded pedestrian crossings as much as we possibly can, hopefully by the end of this fiscal year, which would mean July 2018. So, Dr. Cole mentioned that there have been a few controversial projects. I'm not sure if you've heard about them. I certainly haven't. But this is difficult work, right? Change is hard. And when you want to manage people's behavior and when you want to make a place safer for everybody, sometimes you have to make changes that are bigger than just some paint and some bollards, right? Your signal timing. You have to really change the characteristics of the street. So this is Venice Boulevard in Mar Vista. It is a wide street, old red car right-of-way. It was also a state highway. We had to literally go to the legislature and get them to give this street back to the city so that we could redesign it because it belonged to the state. This is kind of what it looked like before we did this. So we worked with the community for actually about a year and a half. We did hundreds of events. We actually built out the project. And the project is a removal of a lane of traffic for vehicles in each direction and a protected bike lane. So a protected bike lane is where you flip-flop the parking and the bike lane. So the bike lane is close to the curb. The parking is out by the street. It's good for bicyclists because it gives them a clear place to ride. It's good for pedestrians because it gives you a greater buffer from traffic. It's good for drivers because it organizes the street. In general, these are they're difficult initially, but they are really good projects. So we went out and we built it. We put in 4 new signalized pedestrian crossings, and this is Mar Vista during the art walk. These are parked cars. That's not congestion. And the street really looks beautiful. We're very proud of this project. It's a little less than a mile long. And at first, the press that we got about this project was very positive. Yay, pedestrian friendly improvements coming to Venice, but we cannot wait. Wait a second. People are going crazy over this road diet, and it sort of has gone downhill from there. So you are watching in real time, a front row seat to what happens when a community is trying to align its streets with its values. And Mar Vista in particular is a place where there's actually a majority of folks who support this project. And the results of the project so far have been that we've cut serious injuries in half, and that we have added to driver travel time by an average of about 30 seconds. So when you think about that trade-off, you know, an extra 30 seconds of your time to save somebody's life, we think that's an okay trade-off. But we know that, you know, we are in the middle of change management. And so our work really has to focus on, you know, how do we tell this story? How do we hear people? How do we adjust the design to address their concerns? But how do we keep our focus on what we're trying to do? Right, this is my favorite. Selfish motorists. So to just switch gears for a minute and talk about something else which comes up quite a bit. Because of the communities where traffic crashes and deaths tend to impact people the most are also places where personal safety is a significant concern, where people of color in these communities do not feel comfortable walking on their streets, either because of gang activity or because they're concerned about being profiled by police. And when you have an initiative like Vision Zero, which includes an enforcement component, you have to tackle and address and be very straightforward about the other very real issues that people have in these communities that are also related to safety. So we've tried to think about ways that we can begin to start a conversation and address this issue with the asset that we have, with the things that we control, and that's the streets. So we started this program called Play Streets. This is a program we did in about 7 park-poor communities, including places like Watts and Boyle Heights. We've expanded it to about 15 this year. And this is where we take a street, whether it's a block, a few blocks, a mile. We close the street to traffic. We roll up a playground in a truck, and we put it out on the street, and we work with a local nonprofit to help activate that street. And what we found is that you really don't have to do very much work. As soon as you put play equipment out on the street, kids come out of their houses and use it, right? It's a very simple, powerful idea. And when we did the evaluation, this is the kind of feedback that we got. So I'll just read Maria's comment. On the day of the Play Street, the street was safe and healthy. Even the cholos got involved. They brought out a bunch of bikes and a basketball hoop and dressed differently than they usually do. Right? She's saying that the gang members in her neighborhood took off their colors and came out and played with kids. There aren't a lot of other things I can do at the Department of Transportation that get this kind of return on investment. It's a safety project, it's a sustainability or quality project, but it also starts to get into really community happiness, right? Community building, social cohesion, and other things that we have to start dealing with in transportation in particular, and that we have not historically. So if you haven't seen this by Charles Brown, it's in the ITE Journal, excellent article, starts to dig into these issues. There was a great webinar that America Walks put on yesterday that he moderated with the author of The Color of Law, which is a book that's just come out about the legacy of redlining and why our cities look the way they do in terms of racial segregation. So check this out, check out the webinar if you're interested in these topics. This is really sort of the next big conversation that we'll be having. And about 10 years ago, the next big conversation we were having was between transportation and public health. And at that time, I heard a lot of my colleagues say things like, well, why are we talking to these epidemiologists? Like, what do they have? We cannot fix, childhood diabetes. I just want to build this bike lane, right? But now the two practices are really partners and have strengthened both of our work. And that's what I hear now when people, longtime advocates, think about and talk about Vision Zero. Why do I have to take on police reform? I just want to build my bike lane. And I say, it's really going to be good for all of us if we can learn from each other and if we can share data, and Vision Zero is a great place to start and a great way to do that. So that's all we have. This is our information, and we're just about to come out with our year one report, probably in the next few months, which will sort of update our progress, our results, our outcomes, and talk about sort of what's next for Vision Zero in Los Angeles. Thank you.
Questions?
Yes.
So I have two questions. My first question is, I know you guys are kind of working with technology to slow the car down by implementing the red light. So I was wondering if there's any other kind of technologies or any kind of that kind of data monitoring that you're using on pedestrians specifically. And my second question is, how do you see rideshare programs like Lyft and Uber influencing the way you're designing and redesigning the streets?
So the two questions are we using technology to track pedestrian behavior? And then the second is, what is the positive, negative, or neutral role of Uber and Lyft in Vision Zero? Is that good? Okay. So as far as the first question goes, we've just started to work with some of these big data providers like ZenDrive and INRIX and data companies that harvest your cell phone data whenever your GPS is on to give us insight into your behavior, but mostly that's focused on driver behavior. So in terms of pedestrian behavior, we actually have a grant that we got from the Toyota Foundation to use some of our existing cameras. So we have about 750 traffic cameras all over the city of Los Angeles. We do not record and keep the data that we collect or the footage that we collect because we don't want to get in the business of having that data used in criminal investigations and other things. That was a decision made a long time ago. But we do think that using technology, we should be able to use that camera, that sort of feed, to do things like document near misses. So it's one thing to get the crash record, right, when a crash happens. But what about the dozens of near misses at a location that might not show up as a crash, but are real indicators of where we might see a crash in the future? So we think we can, working with some data scientists from we think we can actually use that feed to capture and collect data about walking speeds, near misses, pedestrian counts, those kinds of things, and eventually maybe use it to do things like extend the pedestrian walking time, right? Especially if there's an older adult, somebody with disabilities, a mom with kids, somebody who lives out of a shopping cart trying to make their way across the intersection. They're moving a lot slower than able-bodied folks, and to be able to extend sort of the walking time. So we're just starting that. We're also working in a partnership with University of Washington and Microsoft to do something similar, to sort of citywide sort of crunch all of that video data and get a better understanding about where people are walking, what the behavior is, why, how, et cetera. To your second question about Uber and Lyft, we don't get data from Uber and Lyft. We'll just start there. Right? They claim trade secrets, they won't give us any data, and so we don't have a good grasp on what kind of positive, negative, or neutral impact they're having. The few places that do have data, New York City is one, have found that Uber and Lyft have increased congestion and vehicle miles traveled by about 10%, especially in the outer boroughs. And there was a study that came out, or a news article that came out this week, that Uber and Lyft are responsible for 2/3 of the sort of ticket writing that the San Francisco Police Department does in downtown San Francisco. So early indication is It's not great in terms of what the impact is, particularly in highly urban environments, right? Those kinds of solutions are probably really useful where we have transit deserts, right? Where we don't have good transit service, or where, because it's the middle of the night, or because you're in not an urban area. But for urban areas, for dense urban areas, with a lot of people walking and biking and taking transit, my early nickel theory is that they're actually contributing to sort of deteriorating safety. Yes?
So I have a question about the bike lanes, or the lane closures on Venice Boulevard and in Playa del Rey. So I'm curious about where the statistic of it's only changing traffic by 30 seconds is coming from, because I work in Venice, and although I don't drive, I do take the bus. 4 people in my office live in Playa del Rey, and each one of them has commuted through 3 years to this office, and they've all said that their commute has increased by 30 minutes each way, and they're actually seeing more traffic, not deaths, but they are seeing more collisions because of it. So I'm just curious about where that statistic comes from, because I'm hearing firsthand something else.
Right. So I would say you're hearing something that we call ANIC data. So we have NRICS data, right, which is millions of data points from drivers over several months, both before and after the Venice. So Venice and Playa are sort of separate. So the statistic I quoted is really for Venice, right? So you've got less than a mile there, and you've got lane reduction. You've got a street that went from 8 lanes in some places to more like 6 lanes if you count the turn lanes. And what we think is that there are still adjustments we could make to that design to make it work better for everybody. And so we were out doing, and that it's a pilot, right? We said when we put it in, we want to put it in for a year, measure it, evaluate it, adjust it. And so we've been sort of doing that and going out and paying attention to those pieces of feedback that we get, because we take them very seriously. I mean, I don't mean to blow off the anecdotes that you have. They're real for people. And it's really people missing doctor's appointments, picking up their kids from school. I mean, there are real impacts on people's lives. And that's not the point, right? That's not the goal. So on Venice, at least, we think we can continue to move towards a place where we can bring that down. But it does come from NRICS data, and it includes cut-through traffic, right? So when Venice gets clogged up, are we actually making a problem worse on neighborhood streets, because people are now cutting through neighborhood streets? So we're trying to measure and monitor all of that. Playa is a totally different story. It's actually not part of our high injury network. It was not sort of a Vision Zero project. That's a project where the city there were several deaths that happened on Playa. One in particular, a 16-year-old girl was running across the street, coming from Dockweiler Beach, and got hit and killed, because it's Vista Del Mar in particular. People are able to get up to 55, 60 miles an hour on that street, especially later in the evening, and it's the only beach you can have a bonfire at. So people have bonfires at the beach, it's late at night. It was predictable what was happening, right? So we made some changes on that street, and true to our word, we put them in, we measured, we evaluated, we saw what was happening, and we made changes, right? So we went and restored lanes on Vista Del Mar, we put lanes back on parts of Culver and Jefferson, and we're sort of working through that process with that community. But that one is, these things are not easy to do, but we know that if we don't make changes, that the status quo is the numbers are going to keep going up. So we're trying different things in different parts of the city, and they're very public, right? And so what we don't want to have happen is that you have a chilling effect on innovation, on people trying new things, because there's no reward for trying new things in government, right? So that's where we're focused right now, is continuing to work with those communities and make changes to those streets to try and see if we can bring things into balance. Yes?
First, I want to commend you. I mean, as a constant driver in LA, it's hard to, sometimes people hop in front of you and you're not looking for this pedestrian thing. It's great work that you're doing of trying to reduce traffic and stuff like that. So based on what I could tell, most of the data you guys collect to implement your recommendations, you're getting it from the high injury network?
So we have citywide data, but we're focused on the high injury network because that's where the highest concentration of crashes is, and we just don't have the resources to address the whole city, so we had to figure out a data-driven way to prioritize.
High injury network.
That's right.
When you're focusing on high injury network, is it taking into consideration how dense a place is, the time of those accidents? Does it also take into effect, most of the rebuttal to these changes is that it's hurting business.
Right.
You're not having, so a lot of the, I understand you're talking about equity, and a lot of the changes and the data that you're collecting is relevant, but I would say there's some fallacy, there's some type of worry that you're not taking, that isn't being taken into consideration.
Yeah, so to answer your question, there's a great resource called Measuring the Street that New York City DOT put out when New York City was undergoing its own sort of transformation, that included looking at local sales tax receipts. And I worked in San Francisco for a while. We repeated that work there on similar projects. It's also been repeated in Portland, and now we're doing it here, where we do look at sales tax receipts before and after changes that we make. What those studies found is that universally, after implementation of these projects, after they've been in place for about a year, that the sales tax receipts for the businesses on those corridors outperform their competitors on similar streets by about 7 to 8%, and if you are a bar or a restaurant, that number is more like 10 to 12%. Because the saying goes, cars don't shop, people do. And so when you have a street that really feels good to be on and feels like a public space where the traffic is not going 45 miles an hour and you linger, you stay longer, you spend more money, right? So that's been the case that we've seen on Broadway and downtown, which is another street where we did something similar. But to your point is absolutely valid that, there's more to these streets than just even driver delay or safety, right? It's people's livelihoods. And so we very much try to measure our success in that way.
And again, to that measurement, you're taking into account cities that have great infrastructure for, the trains and bus system and the public transportation system to San Francisco and New York is on a complete different level than what is in LA, where everyone commutes. So that sales tax metric, I'd say, is not really a good representative, a good metric to collect data to implement changes like this in Montana.
Yeah, I appreciate that point, and I hear that a lot. Well, it worked everywhere else, but it won't work here because we're special. And I would just push back on that a little bit and say, San Francisco, Portland, New York, they weren't always like that. And whether you realize it or not, Los Angeles has the second biggest transit system in the United States. We have one of the busiest bus lines in the country on Wilshire. We have the busiest rail lines in the country on the Blue Line and the Expo Line. So we actually have a lot of people who want to get around our city in different ways. So, we're talking about less than a mile in a network of 7,500 miles in a neighborhood. So you have to treat different streets different ways based on their context and take all of these things into account. It's very complicated to work in a city like Los Angeles, but again, we know that the status quo isn't acceptable, so we have to take a different approach. So maybe just a couple more questions, one or two?
Another class.
Oh, okay, sorry.
And that class as well.
All right. Thanks, everybody.